Christine Norton is Professor of Clinical Innovation at Imperial College Healthcare Trust London and Bucks New University. Professor Norton runs a number of gastrointestinal nurse-led clinics. We asked her why measuring the effectiveness of a nurse-led clinic is so important in today's healthcare climate.
I think it's really important to measure effectiveness in a nurse-led clinic. Firstly, it's obviously important to know if you're making a difference to your patients. Are you tackling the symptoms that they're presenting with? Are you improving their quality of life? But also in today's climate, it's really important to know if we're both cost effective and if we're preventing patients from being admitted to hospital or enabling them to be discharged sooner. So I think it would be really naive of us as nurses not to measure our outcomes, to be able to prove the case that we are making a difference and we're saving costs. When you're trying to measure the effectiveness of your service, you really don't have to start with a blank sheet of paper. There are many tools that have been developed across healthcare for measuring patient outcome and patient satisfaction. You can either go with maybe a general quality of life measure, such as the SF-36, or something that's been developed for your patient group, particularly a condition-specific quality of life measure. There may be symptom scores in your area, there may be general satisfaction scores or something very specific about your service. So I think it's easy to think, oh, I've got to invent this myself, but talk to other people who work in similar services, find out what they're doing. The other point is try and make this as easy as you can on yourself as well as your patients. So if you decide you're going to have to post everything out, gather it back in again, input the data into a database and then analyse it, that's a lot of work. So what can you routinely capture that you're going to need to capture anyway? Are there easier ways of doing this? For instance, gathering information in the clinic itself, or increasingly we're using handheld patient feedback devices in healthcare where the data input is done for you and you don't have to do it all manually yourself. There are obviously different approaches to measuring outcomes. You can use a variety of different tools. It would be very wise to try and align them with any national guidelines or national targets or other objectives that your organisation has. So if there are national guidelines on your patient group, look at these and look at the sort of outcome measures that other people are using. So talk to other people running similar clinics. Two basic approaches: quantitative, where you gather some numbers, you gather figures and so on, maybe ask your patient to score their satisfaction or score their symptoms or score their pain. That can be quite easy to then put it all together and come up with an average score, a mean or a median score for your patients. However, you will lose some richness in terms of patient experience if you don't give your patients the opportunity also to tell you what would have improved the service. So there's always an opportunity to add some qualitative comments, an open-ended question at the end about anything else you'd like to tell us about the service, where often you can gather real good information on how you might improve things for your patients. We really don't have good information at the moment on the effectiveness of nurse-led services, and that's a real pity because I'm convinced that we do make a big difference to our patients. So I think we also owe it to ourselves as well as our patients to prove the effectiveness of our interventions and of our services. I think it would be very naive for us to assume that everyone knows we're a good thing and services will continue indefinitely. So I think unless we can produce some hard outcomes, then all of our services are in the long term vulnerable. So I think there are big advantages to measuring things, to be able to say with facts and figures, look, I know make my patients better, this is what they say about the service, this is the value they put upon it, as well as gathering information on costs, average length of stay of patients maybe, or length of engagement with the clinic. So I think information is power in this, and if you've got information about your clinic and you disseminate it to your local area, then you're in a very strong position to argue for hopefully services expanding rather than contracting even in today's economic climate.